A week after the U.S. declared monkeypox a public health emergency, the vaccine is now available, but not everyone will be able to get it. We'll tell you how and where you can get it, and with cases on the rise, what you can do to help protect yourself. Good morning, everyone. It is Friday, August 12th. Thank you so much for being with us here on Facebook, YouTube, and on Twitter. Traveling for many has become a mess, a true mess lately. So it is an important topic, we know, and we promised you that show today. But with monkeypox cases rising, that is where we are turning our attention today. We have top health experts here inside the Dolph C. Simons Jr. Family Broadcast Studio, Medical Director of Infection Prevention and Control for the health system, Dr. Hawkinson, and Infection Prevention and Control Nurse Supervisor Lance Williamson. They are here with us. Also in studio, Medical Officer for the Unified Government Public Health Department, Dr. Alan Greiner. And joining us virtually is the Deputy Director of the Kansas City Health Department, Scott Clardy. So welcome to all of you. Also today, another blood emergency has been declared in our area. How you can help out. And COVID cases have been on the decline over the last few days. So where do we stand as we head into this upcoming weekend? Plus, we are now off to St. Joe, Missouri, as the Chiefs get ready for the first preseason game of the year. We'll get to that here later on today. We need your questions, though, in the meantime, and we continue to hold that promise to get those answered during our program. So make sure you get them sent in to us right now on YouTube, Facebook, Twitter, and you can email us at the Medical News Network. You can find links to those right there on your screen. The Community Blood Center has issued a blood emergency. It is alarming to hospitals and, of course, those who may be in emergent need of blood. The center says the ongoing heat wave, added to summer travel, and a spike in COVID cases has left them with a limited supply for hospitals in the Kansas City area. Chelsea Smith, the marketing manager for the Community Blood Center, is here with us this morning. Chelsea, good morning. Your organization has described the blood supply as unstable. Can you explain what that means and how it impacts patient care?
We are in a blood emergency, which means, simply put, that the blood that's leaving, the blood going out the door, is going out the door quicker than it's coming in. Hospital usage is up just a little bit. We usually see an uptick in blood usage in the summer months. And unfortunately, we are not seeing an uptick in blood donations. So again, we were forced to declare a blood emergency when we dropped to about a 2 to 3 day supply of most blood types. Our O types, which are the most commonly used types, especially in America, O types are down to a 1 to 2 day supply. So it's become an extremely urgent situation.
So, Chelsea, we've been talking since the beginning of the pandemic that COVID has been a big issue for blood centers since the pandemic began. What do potential donors need to know, especially if maybe they've recently had COVID or maybe recently been vaccinated? Can they still donate?
Yes, absolutely. So if you've recently had COVID, we ask that you not donate until you've been symptom-free for 14 days. If you have recently been vaccinated, you can come in and donate same day as long as you're feeling healthy and well. So the vaccination isn't a deterrent. Please don't think that you're not eligible to donate because you get the vaccine. Also, another COVID-related item is just simply that a lot of donors stopped donating during the pandemic, during the height of the pandemic, when things were extra unstable, and haven't come back. So we're hoping that people will hear this latest emergency message and think, I need to come back and make a blood donation, help patients out in our local hospitals.
It's really easy to do. You're in and out in about an hour. For those interested in donating, we put a QR code right there on your screen. It'll take you directly to the blood centers so that you can go ahead and sign up there. Chelsea, I know we've talked about that usually blood supply is lower during the summer months, and you're doing something kind of interesting to get folks to donate. Tell us about Pint for a Pint.
Yeah, so blood, as you mentioned, blood donations always decrease in the summer months. Winter months, we see a decrease in that as well. So for this summer, we partnered with local breweries and pubs to offer our donors essentially a free pint for a pint. So we are partnering with 24 local businesses. You can view a list of all participating businesses online at savealifenow.org/pint. And if you donate August 1st through September 10th, you will receive a voucher that can be redeemed for a free pint of beer, wine, cider, or a soft drink from any of those 24 participating businesses.
And again, we put that QR code there on your screen if you're interested in donating. Chelsea, before we let you go, is there anything that donors should know, anything they need to keep in mind as far as their qualifications to be able to donate blood?
Yeah, so typically medications, a lot of people assume that if you're on a medication of any type that you're deferred from donating. That is not the case. Most medications do not defer you from being able to donate blood. Additionally, if you've traveled out of the country recently, that's usually not a deferment either, but a lot of people assume that it is. Well, I left the country, so I can't donate. Our biggest ask of you, of all those listening, is that if you're questioning whether or not you're able to donate, don't assume that you can't. Don't self-defer. Please give us a call or go online to savelifenow.org, and you can view all of our eligibility requirements there. You can also you submit a help desk question to us, or you can give us a phone call and we can chat with you about any medical questions, any travel questions that you have. Most people can donate, so we ask that you don't defer yourself. Don't assume that you're not eligible.
Great advice. Chelsea, always good to see you. Thank you so much for joining us this morning.
Yeah, thanks for having me.
Well, monkeypox infections have nearly doubled in the past 2 weeks. More than 10,700 cases have been reported across the U.S. 22 of those cases reported in Kansas and Missouri, with 4 of those in the Kansas City area and 1 reported in Johnson County. There is only 1 licensed manufacturer for monkeypox vaccine, and there is a limited supply. Wednesday, the FDA approved plans to stretch those doses. Dr. Hawkinson, how do you stretch a dose of vaccine, and how is that effective?
You know, I think first of all you need the data, and we have this data. This was a NIH-supported study from 2015 that was published. So again, this vaccine is well known. It's a platform that's been used. All of the data are there, the safety data. So what they were doing was looking to increase the available stock in case there was a smallpox outbreak, and so by doing that they tested different forms and different doses. What they were able to find was that if you were able to split the current dose into 5 doses and give it a little bit differently, we're giving it just under the skin now rather than like another kind of injection that we are used to, you could actually spread that 1 dose out into 5, and I think this is great because of the incredible lack of supply of the vaccine. We know how important this is and how important it is to get those people protected. So overall, I think it's a good thing. And again, it's not new. This data is from 2015. It's been well studied and critiqued. So I think it's a good thing overall.
So Lance, how difficult is it to give a shot into the skin versus into the fat that we kind of have become used to with our everyday vaccines?
Yeah, I mean, most people are used to getting a shot in their muscle tissue, and a lot of people get shots in their fat tissue too. This is a little bit different. The good thing is healthcare workers are used to this. We give this with like a TB skin test that has kind of vacillated in popularity, but we used to do TB skin tests a lot. We still do those, and so it's similar to that. It's just a bit different than what we're used to, I think, as a whole.
But why with this vaccine? Why is it administered differently?
Well, it's part of the dose sparing so that we
Okay.
can get more. And yeah, there's multiple ways that our bodies can uptake vaccines, and so I think that this is just another way that we can spread it out a little bit more.
Does it? But we're showing this monkeypox vaccine being administered right now. So going into the skin, does it feel different? Does it hurt? I mean, does it feel about the same as any regular old shot you get?
It can be. I mean, I've had a TB skin test before, so it can feel a little bit different. I mean, usually it's just a quick prick, and you're.
Yeah, I would say that. I agree with Lance completely, but I would say it probably is even less painful. Again, you're not jabbing into the subcutaneous tissue and muscle. In addition, it is a much smaller volume than what you are getting as well, and so it is very, very small volume. And again, I would say it probably causes less actual discomfort at the time of the injection.
Yeah, because a lot of times you'll have a soreness in your muscle and in that area of your arm.
Yep.
So if you think you may qualify for monkeypox vaccine, we do have some information running across the bottom of our screen so that you can get that information and make the call that you need. I want to talk about doses. Dr. Greiner, on the Kansas side, how many doses do we have and how is it being distributed, and certainly to hospitals as well?
Yeah, so in Kansas, the state health department, the Kansas Department of Health and Environment has already distributed vaccine based on data they have on trying to get it to the highest risk populations that they've seen in their prior data. So we've got quite a few doses here at the University of Kansas Health System, and then just down the hill and over in KCK, we have a number of doses at the health department. Also, some of the safety net clinics have doses as well. And so with these changes, everybody's making a few adjustments because we've got to make sure that we've got all the people trained to do this intradermal injection rather than the subcutaneous injection. But it's great because now we know we can do 5 times as many folks as we thought previously. We've already done some outreach at the health department to our high-risk folks that we know we want to get vaccinated early next week, and so we're going to hit the ground running. I think here we're probably starting today in some of the clinics.
So is that a concern, or is it good news if we run through this vaccine as quickly as possible, knowing that it's in people's bodies and people are getting it, they're coming forward and making their appointments, but then how much longer do we have to wait for the next supply?
We kind of got an unknown on that one a little bit at this point. It's sort of deja vu all over again. It reminds me of December of 2020 a little bit with COVID vaccines. The state health department had said a couple days ago, I think, that they wanted to see 90% of this initial shipment get used before they made requests and then redistributed doses. But I don't know if they'll stick with that 90%, but I think it's pretty likely we'll be able to push it out pretty quickly too. We got lots of high-risk people, both in this health system and out in the community that hit the safety nets and hit the health department.
So the message to people is find out if you qualify and come in, right?
Correct.
Yeah, and I think for the question of how much are we getting, how much are they getting, you can go to the HHS Jynneos distribution website and they'll tell you the allocations and how many have been shipped. And as of Wednesday, it looks like to Kansas from Health and Human Services, there's been 1,100 doses shipped as of August 10th. So, but then again, you got distribution from KDHE to the whole state as well, and so I think that's important to understand.
Let's head over to the Missouri side. Scott, what can you tell us about the doses there and how we're getting those to folks?
Yeah, so it's interesting. It's very similar to what you just heard from the Kansas side. Here in Kansas City, thus far, we've received 1,800 doses, which had now, with the change that the FDA has made, that's actually going to stretch out to about 9,000 doses. So we're excited about that because there's definitely a need here. We have lots of folks in some high-risk groups that we need to reach out to and get this going. We have given a few doses already for people who were exposed to known positive monkeypox cases. So we've done that. And again, much like what you heard on the Kansas side, we're getting vaccine out to some safety net providers, and we will start a system next week for folks can go online, sign up if they are in a high-risk group, and someone will be calling them to make an appointment to come in and get their vaccine started. So yeah.
Yes, please go ahead.
I just wanted to say also with the 9,000 doses, keep in mind that's doses for 4,500 people because everybody has to get 2 doses.
So on that note you just mentioned, because Dr. Hawkinson, Dr. Greiner was just mentioning about the limited supplies that we had at the beginning of the COVID pandemic, and so we were putting the people with high risk, they were going first to the line. Doc Hawk, so who is going to be first in line for this limited monkeypox vaccine?
Yeah, certainly anybody with known exposure to a case. Right now, there are a lot of social determinants of your risk factors. Certainly we know that the vast majority of people around the world, and including the United States currently, continues to be in that MSM, men who have sex with men, gay population, LGBTQ. So we really want to get those people protected. And from my friends and people I know in that community, they are extremely well informed on this, well educated, looking to really advocate for themselves, and I think that's great. We really want to get everybody protected, and it starts with them right now at this point in time. There's no stigma attached to that. We need to continue to protect as many people as possible and the highest risk as possible right now. Just as you mentioned with COVID early on, this is a different high-risk population. We want to get everybody protected, but I think overall, The messaging from that community has been excellent. The education has been excellent. Really no misinformation or anything like that. So we are working to get the highest risk people vaccinated as soon as possible.
And I'm glad you brought up the stigma, because that's really, really important about getting people to come in. And we do know that that population, same-sex sex, is a high-risk population. But to be clear, anyone can get it.
That's absolutely right. And we were talking early before the show as well. You know, household contacts can get it. We have seen cases where children can get it. And so again, I think the misinformation comes if you think it is going to stick to one group of people who have opinions about, government or politics or state lines or community lines. That is not going to happen. We have shown that has not happened. So really working toward the highest risk and then kind of going to get everybody else vaccinated as soon as we can to protect people, because we know there can be household transmission as well.
Well, we talk about household transmission. What about, Dr. Greiner, let's just talk about kids heading back to school and close proximity in dorms. People are not distancing anymore.
That's right, and we worry about that. So far, we haven't seen a lot of cases in children or adolescents. I think the average age of cases in the U.S. has been around 35 years of age. But the reason we're working so hard and trying to really jump on this quickly is we might really be able to knock this out to where we don't see a lot of transmission in children, and we don't see in school environments or daycare environments it transmitting. I think in the distant past, when we had a lot of smallpox, we did see a lot of that in children. And smallpox is a very similar virus, transmitted very similar ways through when people have skin lesions. They're infectious. We don't want to see that, and this vaccine could really, I think, really help us prevent that.
So you're saying if you compared it to smallpox, you feel like we are way ahead when it comes to monkeypox?
We've got an effective vaccine. Back in the day, right? We weren't using the techniques for smallpox inoculation that I think we could have in the world. That technique actually goes back centuries, right? But now we've got an effective vaccine, and we have a healthcare system, I think, where we could deliver things quickly, identify those at risk, and I think as Dr. Hawkinson said, folks out there, they're wanting to get this vaccine, and so we got to put the pieces in place to deliver it.
That's what I was going to ask, is what are we hearing from people? Is it a need? Is it, even if we just go back a month or 2 months when we first started hearing about monkeypox versus take us to today and people's need and making the phone call and coming in, you're feeling optimistic about that?
Yeah, we started actually on Wednesday at the health department reaching out. We've got a sexually transmitted infection program over there. So we've got clients that have had different infections in the near term or further in the past. We started reaching out to them by phone, and they were very receptive, and so we've got them scheduled starting Monday to come in, and we've done some of the same stuff here, and I think it will continue here, where we reach out to those we know have had other infections, or we think may have had some contact where they were at risk, and we want to get them injected as quickly as we can. So we've already got sort of our list going over at the health department, and the same will happen here.
Well, I do want to put some information up on the screen on how you can get the shot, how you can get the monkeypox vaccine if you qualify. If we can get that up there. If you are a health system patient, to get it here, you must be a health system patient. You're to call your primary care provider. You can also use MyChart, that app. You can also call 913-588-1227. Again, there is some information on your screen, and you can make that phone call today. We want to get to some community questions. And Lance, we were talking about this. Angela was asking, how different, or is it different, from an STD?
Yeah, I think it would be determined by your definition of an STD. So certainly this can be spread through sexual contact, and the data is clear that this is the predominant way that this is spread is through sexual contact, but really the definition is that close skin-to-skin contact, especially with lesions. That's really where we're seeing this transmission. So sexual contact definitely meets that definition, so it's a possibility, but it's not the only way that this can be spread. And it does require that intimate, close skin-to-skin contact. And that's the good thing about this, is it's spread very differently than SARS-CoV-2, right? It's if it spread via the airborne route super easily, then we would know that by now, right? All of this data shows that people are having close contact, skin-to-skin contact when that spread happens.
Okay, and I'm just going to ask it, Dr. Hawkinson, when we're talking about intimate contact, let's just be honest, it's not, there's hands, there's touching, there's touching your face and touching other parts of your body. I mean, so I think this is why this is concerning to anyone, not just people part of the gay community. I mean, this is a part of anybody's sexual practices. So that's concerning.
And we're not anticipating anyone being able to get this through, like using the train or the bus or, coming across someone in kind of intermittent settings. It really is that, prolonged, it needs to be there too.
And I would say on your last point about the hands, another point to bring up is adequate hand hygiene. Alcohol solutions or the soap and water, frequent things like that. But I think we really cannot get caught up in, is this a sexually transmitted disease or is this not? Because we have traditional thoughts about what sexually transmitted diseases are, i.e. syphilis, gonorrhea, chlamydia. Yes, a lot of what we have seen in this current population, that is the vast majority of the cases around the world, are having close, intimate contact, which, as Lance said, is usually involved in sexual relations. But we know that with just with the close skin-to-skin contact is really how you are getting it. So I think we really should not get caught up is this a sexually transmitted disease? Is this not? We know it is more of that close, intimate contact of the skin. When you have contact with that pustule drainage or any drainage from those wounds or lesions onto your skin, that is how you can get this disease.
Okay, so is this a question then people should be asking their sexual partners? Have you had any exposure or been around anyone with monkeypox? How do you have that conversation?
I'll start. I say yes, absolutely. That is a question, that should be asked 100% to keep it simple. And I don't know if Lance.
I would just add that everybody should take responsibility for protecting themselves, right? And we've given you some ideas of things to look for and questions to ask, and just care about yourself, protect yourself, and be careful.
Protect yourself and others. Good advice, Scott. Question from Sarah though. She wants to know, does monkeypox make you more susceptible at catching COVID, or vice versa? How does monkeypox affect your immunity?
I don't think we fully know the answer to that question, but we're concerned about it. Again, the reason to jump on this and try to get this outbreak under control is because we have so many unanswered questions. We don't know if it knocks your immunity down and makes you more susceptible to COVID. We don't know if it could have long-term consequences. It's very possible that it could have some sort of long-term negative health sequelae for folks, and that's a big risk. We're not seeing a ton of mortality with it across the world with this outbreak, but those long-term consequences could be really, really impactful, and it's certainly debilitating for a long period of time, right? The course of infectiousness is 2 to 4 weeks, so we've got to really work with folks who do get sick to have them stay away from others, and boy, we're back to this thing of just stay home if you're sick. If you get any kind of fever or aches or chills or a sore throat or a lymph node that you think is swollen, please stay home and call your physician, call your providers, and get evaluated, and stay away from other people, because you could have COVID or you could have this monkeypox. We've got to get back to those basic infection prevention practices.
Yeah, and since you brought up symptoms, I'd like to make a good point. From all the data that we have, what we believe right now is you really are unable to spread this disease unless you are currently symptomatic. So I think it's very important to understand what Dr. Greiner said. The other issue is, if you have to take time and just hold off for a little bit on maybe, seeing people or meeting up with people and doing those things that are high risk for catching this disease, then take that time off for a little bit until we can get vaccine. It is important to understand that when you are off for influenza or SARS-CoV-2, you are out for, not very long for work. You can go back to work in, say, 3 to 5 days. With this disease, you are really not able to go back to work or be out public until you have, full crusting of those lesions and the scabs fall off, and that can take 2 to 4 weeks, not to mention the pain and discomfort that Dr. Greiner was talking about.
Dr. Hawkinson, can you give us our numbers today, where we stand and as we head into the weekend?
Yeah, we're still doing fairly well as far as the COVID count in our hospital. Right now we have 24 active infections, 3 in the ICU, 3 on the ventilator, and 20 in that recovery period. Again, I think the full national trend continues to be that, with fairly plateaued, but lower, just a little bit lower overall cases that are actually counted and accounted for. But just still that similar amount of hospitalizations as well. So hopefully we will continue to see a little bit of a downtrend from where we were, say, 2 weeks ago from our hospitalizations.
All right, this just came down yesterday. The CDC saying that people exposed to COVID-19 no longer have to isolate. We've been talking about that for over 2 years. Agency now recommending just masking indoors, testing after 5 days for people who are up to date on their vaccine. So any concern on your end for this?
Yeah, I mean, this has been happening really practically for the general public for the most part anyways. And I think what they are focusing on, what the CDC and the administration is focusing on, is protecting those that are highest risk of hospitalization and death. And those are people, of certain age with comorbidities, things like that. What do they say to do? What is their really top line in prevention? And that's being up to date with vaccines. Hopefully we'll get some new recommendations for the boosters coming up, but that is really the most important thing, as well as testing early, getting on Paxlovid. Their focus really is on those highest risk of people, those at risk of hospitalization and death. And I don't know if Lance has anything to add to that too.
Yeah, I read through the CDC updates, and it's clear they're really trying to refocus on the people who are sick, if you have symptoms, similar to the things that we do for other endemic respiratory viruses that we have. I think they're just trying to refocus on the things that we know work, masking, things like that.
I think it should be noted, as we saw that graphic up there, you are, if you are known to be exposed, to put on and wear a mask. And then really at day 6, I believe, or day 5 after that exposure is to test with an antigen test. So there are some nuance to those guidelines, but overall, again, the focus is on protecting those at highest risk. And the best way for protection is to be up to date with your vaccination.
Scott, just your comments on this latest recommendation from the CDC.
Yeah, I think I would agree with everything that's been said. I think basically what you see is CDC moving to what is practically been in place for some time. We're encouraged by the fact that we have so many avenues now to protect ourselves that we didn't have 2 years ago, right? That's why you're seeing some of this relaxing, is because now we do have effective vaccines and we do know of ways to protect ourselves, like masking and that type of thing. So we're happy to see this. I think we're in agreement with it. The only thing I would say is, just to be clear, if you do have COVID, you still need to isolate and stay home. I mean, we've been talking about people here who have been contacts to positive cases, but if you're a positive case, you still need to stay home for 5 days at least. And then, if you don't have a fever without any Tylenol or something like that, then you can go out again. But that's still in these guidelines. So.
All right, let's talk about this. Cases leveling, the CDC lowering the risk now of contracting the virus in most of our area counties. So, Dr. Hawkinson, what does this indicate? Because we've been talking about a possible surge that we're expecting in the fall.
Yeah, I mean, I think we have to anticipate something. We don't exactly know what that is going to look like. Again, if it was like this current surge compared to the winter surge with Delta and Omicron itself, it looked much different. It looked much different because one of the reasons is why the CDC lowered and changed their guidance, because of immunity from vaccination, immunity from infection, or the combination of both. So I think we will continue to see that, but will there be a next surge? I think we have to anticipate that still. We don't know what that will look like, nor what the next variant will look like. But I think it would be foolish not to. Plus, when you go back to the fall, you are having more indoor activities. You're having all those colleges go back and get togethers, things like that. So I think we have to. It's just unclear what it will look like. But most importantly, we'll be waiting for those booster recommendations.
So the Wall Street Journal reporting that COVID-19 variants are getting more contagious. Is this true?
Yeah, I'll kind of give a quick answer and then let some of our guests answer. It's hard to really understand. I mean, nobody has really put the the thumb down on what do you mean by more contagious. Certainly if you are talking about evading the immune system as far as antibody goes, yes, that is true. Again, these vaccines and prior immunity doesn't really protect against infection per se. There is some minimal protection there, but really the vaccines and the prior infections really are meant to protect against further severe disease and hospitalization. So, you know, what we have seen is that this variant is more contagious than that variant, and then the next variant is more contagious. At some point, it seems like just saying the word SARS-CoV-2 is going to get you infected. So they keep talking about that, and I think that is more about just the ability of those new variants to evade that immune system response of the antibodies, but we know you still have your T cells, and really that is what helps protect you against the further disease progression, such as having to go to the hospital in the ICU, and then I'll kind of leave it open to our guests.
Yeah, and I'm sure you've seen this, Dr. Hawkinson. I know I have with my patients. You know, in the last 6 or 8 months since we started seeing Omicron variants in high numbers, people do get reinfected. You know, we've talked about this sort of having 90 days of some natural immunity.
Yeah.
Even if you've been vaccinated, boosted, maybe even had a prior Omicron infection, you could still get it, you know, right now, and we may see people getting it in the fall and into the winter. We've got Paxlovid now, which is a big step forward. I'm sure you're prescribing it. I think I prescribed it to 2 people yesterday over the phone. So we've got those tools at hand. We just have to keep the population in contact with their healthcare providers, with the public health folks, and be ready to, if we get a new booster that's got some more specificity for these variants that are out there now, we got to push that out heavy once we get it in October, November.
Are there any reporters on the line today? Okay. Jump in if you have any questions. If you are just joining us, we are talking monkeypox with Dr. Dana Hawkinson and nurse here at the health system, Lance Williamson, as well as Dr. Alan Greiner, medical officer for the Unified Government Health Department, and Kansas City Deputy Director of the Kansas City Health Department, Scott Clardy. So Scott, Fox 4 is reporting that Kansas City area pediatricians, daycares, they're really keeping an eye out on monkeypox. So how do you prepare? We're starting this school year. We're sending our kids back out there into the unknown. There's no vaccine for kids. What are your thoughts on this?
Yeah, you know, I think it was mentioned earlier during our session here that we have seen some kids, not here, but throughout the outbreak, we've seen some kids that have become infected. But it's my understanding those have been household contacts to existing cases. And so, you know, I think with kids, you just want to basically do the same thing you do with adults. Watch for signs of infection. Do what you can to keep kids away from folks who are who have active infections. If you have someone in that household, isolate that person as much as absolutely possible to protect the other people in the house, including the kids. And then other than that, you just watch for infections. And you know, with the physicians on the line can maybe comment about this more. But it's my understanding that as of August the 9th, there is the FDA has said that we can give the Jynneos vaccine to kids, to people under the age of 18. We would not do the intradermal shot. We would do the normal shot into the, you know, into the arm like we're used to for those kids. But that would be for kids that had been exposed, just like what we're doing for adults now. It's not a preemptive type thing. So, you know, I think the best thing you can do is just try to protect the kids. If you know they're going to be around somebody who has monkeypox, try to isolate them, and then watch for any signs or symptoms. If you see signs or symptoms, contact your healthcare provider right away.
So, Dr. Hawkins, you've mentioned that a rash has been a sign of monkeypox. Is that the only early sign? What else, as Scott had mentioned, should we be looking for in kids or adults?
I mean, typical signs of illness. So fever, chills. Dr. Greiner mentioned swollen lymph nodes. I think that is extremely important. You know, lymph nodes either in the groin area, under the armpit, are probably going to be the most common sites if you start to have some tenderness or swelling there. Tiredness, muscle aches. I mean, these are symptoms that are really non-specific. And then we'll talk about, of course, the rash, and that can look like pimples, larger pimples, blisters. We know that they will then evolve into also umbilicated, which those are kind of like blisters or pimples that have little indentions in the middle of them. And then, of course, they can start to drain and have drainage and then scab over. So it's really going to be those other prodromal symptoms such as fevers, chills, swollen lymph nodes, fatigue, really to look out for. And I think we should really continue to monitor children, especially in those kind of congregate settings like daycare. We know how easy it is to spread diseases through those things such as hand, foot, and mouth disease, gastrointestinal disease, obviously respiratory infection. So it is going to be vitally important to monitor those places as well. And I think there was a great comment by our guest. You know, the EUA, as far as this week, yes, you are able to give the vaccine, Jynneos, to those under 18, but just as he said, in those high risk or exposed children. So, but I do anticipate, and we'll see how correct this is, as supply gets more for the vaccine, and we continue to move through this, if we are seeing the same progression that we have been the last few weeks, I suspect there is going to be a more general vaccine campaign going, but who knows? Hopefully not. Hopefully we'll get this under control.
I've got a couple more quick questions, and then we're going to get to some great community questions as they are coming in. Okay, so Dr. Greiner, the first case here was July 9th, monkeypox discovered in Johnson County, and then we've had 4 other in Kansas City since then. But it's said that this across the nation has been spreading faster than previous monkeypox outbreaks. Is this mutating? What can you tell us about its journey?
I don't think we know, but it does look different. You know, we had an outbreak in the United States, I think in 2003, that traced back to prairie dogs and then humans that interacted with those prairie dogs, but we didn't see any human-to-human transmission, I don't think, in 2003. That now, you know, we're seeing a lot of human-to-human transmission. We think that this viral strain, or they call it a clade, traces back to Western Africa. There's also a clade from the Congo, but something may be slightly different about this in that, you know, we're seeing a lot of human-to-human transmission. We're not seeing a lot of household transmission, although, as Scott mentioned, we've seen a few in the United States, but not very many. The prior data sort of suggests that we would see 9 or 10% of those who live in the same household with a case get it. The attack rate would be 9 or 10%, but it doesn't look like that's sort of bearing out now. And that's why we do want people to think about their risky behavior. You know, we don't want people having multiple sex partners. We don't want people having sexual relations in an anonymous environment or in a group setting. And I think people are changing their behavior. So if we can get the vaccine on top of that knowledge, I think there's a good possibility we really can knock this out, like we've been able to do with prior outbreaks like the 2003 one. But we've got to act quickly, and we don't want stigma or other factors to get in the way of doing the right thing for health here.
Don't let that keep you from making that phone call. I want to get to some community questions because they are some good ones. Janet wants to know, are people hospitalized due to monkeypox if they let it go too long?
Yeah, not really. The last number I saw was about 7% of the cases have required hospitalization. We do see most patients being treated mostly in the outpatient setting, and then just supplemental treatment for symptoms at home. So we are not anticipating a lot of hospitalizations. What requires hospitalizations with monkeypox typically is associated with the pain. In the gay community, I've heard of stories about folks having just immense suffering, extreme pain when it comes to these lesions and where they are on the body. So that's really important for us to, I think, consider with this. And the good news is most of the patients are receiving supplemental care in outpatient settings and at home.
Yeah, I think that's a great point. You know, having this infection in itself is not an indication for hospitalization, just as having SARS-CoV-2 is not an indication for hospitalization. But what we are seeing is the vast majority of people that are hospitalized for it are typically hospitalized because of that pain or some other atypical presentation. So I think it's important for the general public to understand that.
And Taylor's asking, has anyone died from monkeypox in the U.S. so far with this round?
I don't think we've had any deaths. I think in prior outbreaks of monkeypox, I think we saw higher death rates. Dr. Hawkinson may have the exact numbers, but we're just not seeing that. So again, there might be something different about this that's that's good for us because we can get on top of it with this vaccination.
Yeah, there have been deaths in other countries. I know I just read about a death in Spain. So
Portugal,
some of those UK countries have had some deaths, but very limited numbers.
Isaac's curious how long monkeypox can survive out in wet surfaces, like at the pool, inflatable tubes, or on water slides, or if you're sitting on, lawn chairs out by a pool. Does chlorine kill it? Are those things that you need to be wiping down, or are we back to wiping things down again?
No. We need to, we're not considering wiping down our mail, our groceries. Like, we should not be concerned about this in those type of settings. And I wouldn't be concerned about contracting monkeypox from a pool. You do need, I've already seen studies of, the virus can live on surfaces for a certain amount of time, but I think it's important to consider that may be a lab setting where we're doing some research, right? And real world, we just don't see that happen, right? And the data is clear that these cases are someone with monkeypox having close skin-to-skin contact with another person.
Okay, but not, because I think, Lance, what I'm naturally asking is if somebody touches themselves, I mean, we touch our own bodies, that happens, and then you're touching surfaces or you're touching doorknobs, and then, of course, you're going to tell people to make sure you're always washing your hands. But I think that's what people mean. Like, is it, you scratch one of these lesions and then you touch a surface, or you touch something out where your colleagues are. So I don't know. I mean, I think that's what people are concerned about, because we have another question about toilet seats. Should people be covering their toilet seats in public?
So I would just back up what Lance said there. The data does not play out. Like you said, in a lab setting maybe, but what we're seeing is well over 90% of these cases are people who are having close, intimate contact with each other, prolonged contact. So worrying about picking it up from a surface, we're just not seeing that as an issue of concern in this particular outbreak.
And I think it goes back to just infection control standards that we follow. Anytime you're touching surfaces that could have germs on them, think about the ways that those germs can get in your body, and it's mucous membranes, right, and non-intact skin. So I want like healthy, moisturized skin on my hands, so I don't have any like open sores. And I also don't want to touch my mouth, my nose, my eyes when I'm touching surfaces that might have a lot of germs on them.
I've heard you say that for the last couple of years, so I think it's ingrained. A couple more questions here. Let me see. Well, Wendy wants to know, if you're due for a booster, should we wait for the new one or just get it now, Dr. Hawkinson? What's your advice?
Yeah, I think we're talking about the SARS-CoV-2, the COVID. That's hard. A couple weeks ago, certainly would have said, absolutely, if you are not up to date, you need to go have gotten that booster yesterday. We are getting closer now to when new recommendations will be made. I think it's a very gray area. Understanding your overall risk, understanding that probably within the next 4 to 6 weeks there will be recommendations and possibly rollout of the vaccine as well. So it's a very gray area. Understand your risk. Understand that if you do have symptoms and you are not up to date, meaning if you are in that general category for that second booster, which would be your 4th shot, then get tested early, get on packs a little bit early. So it's a gray area. We're kind of in a lame duck period, and I think different experts would say different things.
A couple of questions on this one. Yen Liang is asking, for some people in their 60s who got vaccinated for smallpox back when they were kids, do they need to get vaccinated for monkeypox now? Why or why not? Are they still protected? What do we know?
I don't think we know a lot about that. I'm old enough that I had that, but back in the day, and then smallpox was eradicated, I think in 79, 80. But so if you're in a high-risk population, or you've engaged, especially in the last month or so, in any of these high-risk behaviors like anonymous sex or like multiple sexual partners, we want you to get vaccinated with this Jynneos vaccine for monkeypox, whether you had a smallpox vaccine in the past. We don't know the answer, so if you're in that group, get it done.
And Lance, how many doses of vaccine does an adult need to get vaccinated fully for monkeypox?
FDA recommends 2. 28 days apart, so similar to that, what we're used to with that first round of COVID vaccines. They did say that you can stretch that to 5 weeks between, and I know that I think it depends on your access to vaccines too. So you can get it after, but really the best approach will be 4 weeks after your first dose is getting that second one.
Okay, I know some of these questions seem repetitive, but I'm hoping to put some people's minds at ease. Tanya asking, could you get monkeypox from a towel or a razor, like a hairdresser? It's something that maybe wasn't properly cleaned or sanitized properly.
Yeah, again, we're just not seeing that.
Okay.
So we're not concerned about toilet seats. We're not concerned about the hairdresser. If you're a household contact of a case, we are concerned about maybe towels and maybe bathroom use, because that's a prolonged contact situation in a household. But in the public sphere, we're not concerned about that.
So then how do people protect their inner circle, their family, their kids? If somebody were to have it in the family, what and for how long should they be making sure
I
that
think again, it's like watching for symptoms, fever, aches, sore throat, lymphadenopathy. If anybody's sick with anything, right, we should, in a household or in the world, right, we should put that person in as much of an isolated environment as we can in that household, in their own room, using their own bathroom if we can. The same is true with COVID. If you've got somebody in the household with it, we want to get separation so we're not seeing that transmission.
Yeah, CDC has some good information on their monkeypox page about how to isolate someone in your household. And the good thing is normal household cleaners that we have are effective against this virus, as well as SARS-CoV-2. So good cleaning and disinfection practices are going to be great too.
So the pandemic has helped prepare us for the same type of protocols that you would have us do with monkeypox.
Yeah, in some ways, yeah.
Okay, question from Jen to Scott. Scott, how is the Kansas City Health Department working kind of in tandem with other local and health state departments to help slow the spread on the Missouri side?
Yeah, so the vaccine came from CDC to the state health department. Well, it came directly to local health departments, but the state health department took care of ordering that and getting it distributed. So we are in at least daily contact with the state health department, especially with setting up this, this vaccine distribution that and administration that we talked about for next week. We are working with some of the other local health departments in our area to actually put some of the vaccine in some of them also, or so they know that they can send any cases or any folks who are high risk here, so that we can administer vaccine for them. So we're in constant contact with our public health partners regarding monkeypox. We have been for weeks now.
Dr. Greiner, I'm sure it's the same for you.
Yeah.
Constant communication.
Yep, back and forth across county lines, state lines, back and forth from the county level to the state level. And of course, we're working with health system partners all the time too. We've all got to work in tandem just like we did. So again, hopefully COVID has helped us in some of the preparation and the methodology we'll need to use.
Using some common sense. Last questions from Debbie. Dr. Hawkinson, for COVID hospitalizations, what's putting people in the hospital right now? Is it still lung issues with these latest variants, or is it something else?
Yeah, I mean, it is mostly still that respiratory type symptom. So it would be the lung issues, things like that. For COVID hospitalizations, that has continued to be consistent. Obviously, that is the major organ that is affected when you have the infection. That continues to hold true now as well.
All right, we're going to get to some final thoughts from our guests. Such a great conversation today, and just glad you're all with us to have this conversation. We'll keep it going. Dr. Greiner, I'll let you get us started.
Well, I think, like we said, we've learned some things about viruses and infectious diseases. We need to apply that now to monkeypox, because we probably can contain this. It's not quite as transmissible as COVID, so if we can get vaccine in arms, if we can get people to change their behaviors, staying home if you're sick, staying away from others if you're sick, getting tested. We haven't talked a lot about it, but there are effective tests for monkeypox. We've got treatment for it too. We haven't talked a lot about that, but there is a medication that can be used to treat it, and now we've got the vaccine, so we've got to get those into high risk folks, and I think a lot of us are going to be doing that in the next few days and coming weeks.
Lance, what do you want us to know?
I was listening to a podcast about monkeypox in preparation for this, and Dr. Stephen Thrasher is a virologist who had a quote that said, viruses expose the fault lines of society. And that really resonated with me. And I think as a member of the gay community, I just want to be really clear that this is not a gay issue. This is not a issue by country. This is an issue that impacts all of us. And our duty in public health is to focus on the communities that are at highest risk, that are disproportionately affected by this. And so that's what we're doing now. And the window to get this under control is narrow, and it's closing quickly. So that's why we're trying to move really fast, and everyone needs to do their part because we're all connected.
Thank you for sharing. That's a great message, Lance. Appreciate it very much. Scott, your final thoughts today.
Well, I'd like to build a little bit on what Lance said there. At Kansas City Health Department, we've heard quite a bit from the high-risk communities, and I just want to address them directly and say, we hear you. We understand your concerns. We're fighting for you to get more vaccine out there, and keep an eye out next week for some news to be sent out about how you can get signed up to get the vaccine if you've been in a situation where it could have put you at high risk. So we look forward to that and look forward to continuing to work with the community as we get this under control.
Thank you, and just thank you to everyone for helping strip away the stigma behind putting your health first. Dr. Hawkinson, final thoughts.
Yeah, just going to echo our guests, and thankful now that we are able to expand and stretch our vaccine doses fivefold. And I think that's great. We want to impact all of the people that are going to be the most high risk and mostly affected. Keep people safe, and that's what we're here for. Just as Lance said, we're looking for individual and public health to protect the people of our community. And I think Kansas City, Missouri Health Department, University of Kansas Health Center, health system, and of course, Dr. Greiner at Wyandotte and all his colleagues are doing a good job of that. And so hopefully everybody will be safe. I know I'm looking forward to having a wonderful weekend out there, but please be safe. Use hand hygiene. If you're not up to date with vaccines, please go get your vaccines. And that is for everything, even with those childhood vaccine preventable diseases, because we know polio has that issue going on right now in New York. It's just important to stay up to date with vaccines. So.
All right, thank you to all of our guests, including Chelsea Smith with the Community Blood Center. Get out and donate blood if you can. All right, we want to put this information back up on the screen now about how you can get your monkeypox vaccine and to find out if you qualify for one here at the health system. You do need a patient to get it here at the health system. That's correct, guys, right? Okay. You could go to your MyChart app on your phone. Go in there. You can call 913-588-1227. And again, just make the phone call, and then they will kind of help usher you through the process so that you can get that vaccine. Well, the Kansas City Chiefs head to Chicago this weekend for the first preseason game of the year. We are already in our second week of training camp, if you can believe it already. Alan Van Zant talked with our doctors to find out just how tough training camp is for the players and also for them.
We are here on campus in St. Joseph at Missouri Western State University, where the Kansas City Chiefs are in the middle of their 12th year of training camp here, and joined by Paul Schreppel and J.P. Darsh here. Thank you both for being with us. You are both physicians with the health system, but you both have a pretty good side gig here. You're wearing your Chiefs garb here. What do you do for the Chiefs?
So I'm the head orthopedic surgeon for the Kansas City Chiefs, and then J.P. Darsh is one of the internal medicine and primary care docs.
So the goal is hopefully that you are pretty quiet during your time here. We don't want you to be very busy. We don't want the players getting hurt. But what do you see as far as injuries to the players during training camp?
Well, from my end, hopefully we want to be bored. We want to be doing nothing and just chatting on the sideline. But once in a while, the stuff we'll deal with is, besides all the orthopedic injury, we'll see the guys getting dehydrated, especially with the heat that we can get here in St. Joe's. And then we'll have, hopefully, knock on wood, we don't have too many, but concussions and basically anything else that you can think of that can happen. And so far, we've been pretty lucky. So we hope it stays that way.
You guys are kind of unsung heroes during the course of a season. As players get hurt, the idea is as they do get hurt, you patch them up and get them back on the field as fast as possible. How much fun is this for you guys to be doing this?
Yeah, I think it's always fun to kind of work at the pinnacle of your profession. So we're working with the best athletes in the world, and one of the most popular sports in the world. So we've got a lot of incredible athletes and a lot of incredible resources to help these athletes recover and also to help prevent injury. So our athletic training staff, Rick Burkholder and his team, do an exceptional job at really putting these guys through rigorous screening, making sure we do our best to identify movement patterns and things that may predispose to injury in an attempt to really minimize the chance that these guys do get hurt, and then also really helping through the post-injury rehab to get them back safely but as quickly as possible.
And the health system is the healthcare provider of the Kansas City Chiefs. Once again, that has to bring a certain amount of pride as well.
Yeah, of course. I think it speaks for itself. We were definitely the premier healthcare system in the area, in the region, and and we take not just what Paul and I do and the other team physician is we also take advantage of all the resources the health system has, all the variety of different specialties that we have, and I think we provide the Chiefs a tremendous quality healthcare. And it's fun. With the good team needs a good medical team, so I think we do a pretty good job.
So you guys are inside scouts for us. Are we ready for another big year this year?
Yeah, I think Coach Reed's always going to have these guys well prepared, and obviously Pat is Patrick Mahomes. So I think, when you got those two, you can build great teams around them. We've got a lot of youth and energy and athleticism that's coming this year. So it's been fun to watch at practice, particularly as they started to get into pads. But these guys are feeding off each other, and it's been an exciting, very motivated camp so far. So
lots of fun ahead, Dr. Schreppel. Dr. Darsh, thank you so much for being with us today. And how about Go Chiefs?
Absolutely. Alan, thanks so much. And thank you for being with us today. Don't forget you can catch our program anytime by logging onto Facebook, YouTube, and Twitter. So go out, make it a great weekend. And of course, Go Chiefs. We'll see you back here Monday at 8. School is supposed to be full of wonder and fun, not scary. I'm Jessica Lovell. With 27 school shootings so far this year, anxiety is high as students head back to class. Monday at 8, ways to ease those fears and other classroom concerns.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.